Thank you. Good morning. My job is to talk about the report that you got this morning. And so let me give you a little bit of context for the report. A number of you are involved in Partnerships for Healthier Fairfax. I don't need a show of hands. I know who you are, because I'm involved in that too. A number of you are involved in Partnerships for Healthier Arlington. I don't need a show of hands. I know who you are. I'm involved in that too. A number of you are involved in Partnerships for Healthier Alexandria. I don't need a show of hands. I know who you are. But we don't have a Partnership for Healthier Northern Virginia. All of those partnerships, quite correctly, look at their own cities and counties. But we don't have anything that looks across the region. So the Northern Virginia Health Foundation Board and staff talked about having a view of the region, not just of one jurisdiction. And we were very intentional about that because what we wanted to do was to see how we were doing as a community, not just a particular city or county. We asked Community Health Solutions, which is based in Richmond, to do the data analysis. Some of you may know Steve Horan. I don't know how many of you know Sharina Gibson, who is fabulous, who did a lot of the work. There she is, stand up. Thank you. So I'm going to jump into the slides if I can figure out how to do this. I was given instructions. Yes. So this is the first, I'm just going to do highlights of this report. You can read it at your leisure. You will be tested on it in about 6 months. As you can see, Northern Virginia has several counties that lead the state in health outcomes. Fairfax County's number 1, Arlington's number 3. Those are the rest of the counties. But it's clear that while we have a lot of people who are doing really well, not a lot of people are doing so well. And it's more complicated when you look at it at the city and county level. We need to recognize, and I know most of you do, but we need to recognize that much of what makes us sick is preventable. Much of what makes us sick is related to where we live, where we work, transportation, housing, income, all of these factors. And as I had the occasion to say to someone yesterday, while race and income play a factor in this, it's not the driver in a lot of instances. So it's really easy to think this is about poor people and poor health. That's not the case. So I want to just highlight some facts which a number of us are consider sobering. So, more than 5,000 women in Northern Virginia don't get early prenatal care, compared to 13,000 in the state, but 5,000 women is a lot of women. We looked at obesity. An estimated 58% of the region, which is actually slightly more than 1 million people, are overweight or obese. So I need to put that in context. We have 2.3 million people in Northern Virginia. About 1 million of them are overweight or obese. We looked at binge drinking. As you can see, an estimated 20% of the region, so let me just tell you that's nearly 350,000 people are at risk for binge drinking. We looked at kids between the ages of 14 and 19. An estimated 25%, that's about 42,000 kids, say that they feel sad or hopeless 2 weeks or more in a row. 42,000 kids. So I was in one of those partnership meetings that I mentioned in the beginning, and a woman stood up who is relatively well known. She's not an elected official, I'll just say that, but relatively well known in this region. And she told this story that just broke my heart, and I tell it a lot, and so I'm going to share it with you. She said that she had a son who was 17, who was depressed. She had very good health insurance, but she had gone through all of the opportunities that her health insurance provided to treat the depression. And she was at her wit's end because he was saying he was thinking of committing suicide. And she didn't know what to do. So she was talking to her neighbor. Her neighbor said, call the cops. And she looked aghast, like Marlene just looked aghast, and said, what are you talking about? And her neighbor said, they will take him. So she called the police and said, my son is going to harm himself. And they took him to jail, and he got 3 days of psychotropic meds. He couldn't get them anywhere else. That's pretty bad. But there were steps along the way before he got to that point where interventions could have happened. Didn't happen. We looked at oral health. So an estimated 22% of kids, that's about 123,000 children, haven't seen a dentist in the past year. And an estimated 24% of adults, which is slightly more than 400,000 folks, haven't been to a dentist in the past 2 years. So let me just ask you, is there anybody here who has not been to a dentist in the past 2 years? I'm not going to ask you to raise your hands because I suspect that there are people in this room, but we know this is a problem. So the last slide, this is an interesting slide. The last slide is actually not in the report. It comes from the Virginia Atlas of Community Health, which will be an online source of community health indicators, which will be available to the public in the coming weeks. It's going to be on our website as well. It will provide data and maps and more than 200 health indicators. 200 health indicator variables, so you'll be able to figure out where you are, what you're doing, what your communities are doing. This map, though it's not as easy to read as we would like at the moment, shows about 328 census tracts. 108 of them, the darkest blue colors, show communities that rank high on what is called the Health Opportunity Index of the state. Other census tracts show folks who aren't doing so well in the lighter colors, places like neighborhoods in Alexandria and Arlington and Fairfax and Prince William County. More information on this is going to be available, as I said, on our website, and we will send you an email so that you'll know that it's up and running. So that's a little bit about how things stand in Northern Virginia. Nope. Sorry. Now we're going to hear from 3 people. First, you'll hear from Dr. Len Nichols, who directs the Center for Health Policy Research and Ethics at George Mason University. Dr. Nichols will discuss where we are with health reform in the Commonwealth, and he's joining us by Skype. Then we're going to hear from Dr. Stephen Wolf, who leads the Virginia Commonwealth University Center for Human Needs. As we all know, there's so much more to being healthy than seeing a doctor. Steve will share some of his latest research on the factors that are beyond health and that, in fact, contribute to poor health outcomes. And then we'll hear from Dr. Gloria Aduayensu, Health Director for Fairfax County, who has seen firsthand how these health challenges impact the residents of Northern Virginia. She will help set the context for the second half of our meeting, when we will discuss ways to work across silos. After all of the speakers have finished their presentations, we'll have time for Q&A. I'll remind you of this now, but I'm going to remind you of it later. So if you are interested in asking a question to any of us, there are 2 microphones, one there, one there. Please come up to the mic, and before you pose your question, state your name and organization. Thank you very much.